Hi, this time I would like to talk to you about another disease that we see in dogs called leptospirosis. Leptospirosis is not nearly as well known as Lyme disease, but it is as worrisome to us as clinicians as it is to Lyme disease. Leptospirosis is a bacterial disease. It affects many wildlife animals. It is transmitted through the urine of those wild animals, and it can live in soil and in water sources for months to years. In fact, water or moist environments actually encourage the bacteria to live longer than if it was dry and arid. And so this past year, we had lots of rainfall last summer. We saw the number of cases of leptospirosis go up dramatically in our pets. Dogs that go outdoors, even into the backyard, are at risk. Years ago, we only saw it in dogs that went off leash in the woods. These days, we're seeing it even in backyard dogs. The newest subset of dogs are actually indoor, small breed dogs in inner city environments where the rodent population is transmitting the disease. The way you contract the disease is picking it up from contaminated soil, coming in contact with water that's been contaminated. If you consume or if it gets into an open cut in your hand or in your dog's body, you get infected that way. It likes to live in the kidney, number one, but it can also live in the liver. Many dogs that are not vaccinated, when they get exposed to lepto, will get sick very quickly and quite severely. In the cases that I have had of acute leptospirosis in unprotected dogs, they have died from liver and kidney failure, usually within 1 to 2 days of the diagnosis and onset of symptoms. So very, very bad. To save a dog that has that level of disease usually is a $10,000 plus bill at an emergency practice with 24-hour care, and not many people can afford to do that. So vaccination can protect your animal from getting severe disease. Now, I did say it protects against severe disease. Your dog can still get lepto. However, they don't get the type of disease that causes them to be sick and hospitalized. Usually we're catching it because we're running annual blood work testing, so wellness blood screens. Most animals may be asymptomatic, and we find that their values are elevated, and it makes us go, maybe we should think about that. Or they present with just nonspecific GI signs, not eating great, maybe a little vomiting, acting punky. We run blood work, and lo and behold, we see problems with liver and kidney. These particular infections are responsive very nicely to antibiotic therapy, so treatment is available. So no fret if your dog gets it. But we do want to make sure that you do take your veterinarian's recommendations for regular blood work. Make sure that you talk to your veterinarian about recommendations for vaccination. Now in New England, lepto is a real problem. We are seeing cases every week across Middlesex County. So something that you want to talk to your doctor about if we haven't done it before. There's a lot of information on the internet about side effects of vaccines for leptospirosis. Prior to about 2012, our leptospirosis vaccines were what we call noisy. When they make these vaccines, they're taking a section of the bacteria and they're letting in the lab allow things to react to it, and those antibodies are what they inject into your body and get a response. Well, what they were finding with the early vaccines is there were so many things to react to on the surface of that bacteria that the vaccine had a lot of stuff in it, which created a big immune response. So a lot of reports of dogs, especially toy breed dogs, having anaphylactic reactions. The vaccines were revamped in the right around 2020, 21, 22. 2010, 11, 12. And when they did that, they were able to clean up the noise and finesse the vaccine so we were only stimulating the immune system a little bit. Since then, we've been able to successfully vaccinate dogs of all breeds with no severe reactions. Maybe soreness at the site at the most. With multiple vaccinations, your dog might feel kind of crummy, so we might talk about medicating your dog prior to vaccination or spreading vaccines out. But it is something that you really should consider. Now, one more thing I want to mention about leptospirosis, it is zoonotic. What that means is people can get lepto by either coming in direct contact with infected urine or infected soil and water sources. So gardening in your backyard is the type of thing. So wear gloves, make sure that you wash your hands well, and if you're not feeling good, of course, contact your doctor.